In this video, you're going to learn about a promising B vitamin therapy for helping kids with autism. I'm going to walk you through the type of folate being used to treat autism and why it can be helpful. I'm Dr. Mark Stengler. I've researched and written 20 books on nutrition and functional medicine, and I've been in practice for over 30 years. So let's dive in. There's a core problem with having a shortage of folate in the brain. So you may have heard the discussions that have been on the news, it's been on the internet, about a B vitamin therapy showing promise for individuals with autism. Now, this has created both excitement and confusion, especially about the different forms of this vitamin. So folate, also known as vitamin B9, is an essential nutrient for brain development and function. Now, folate plays a critical role in many processes in the body. It's involved producing the brain's chemical messengers. It's needed to build DNA. It's also needed to maintain healthy brain cells. So you can see how this is all tying in terms of brain function and autism. But here's the thing. For folate to work, it must first be transported from the bloodstream into the brain. Now, this is managed by special proteins called folate receptors, and they act kind of like gates into the brain cells. And so they decide what can come in and what can't. What they have found is that in a significant portion of individuals with autism, and some studies suggest about 70%, the immune system mistakenly attacks these gates or these receptors, and it creates what's known as folate receptor autoantibodies. And these autoantibodies, or these antibodies against the receptors, block or disable the receptors in the brain for folate. And this results in a condition called cerebral folate deficiency, also known as CFD, where the brain basically is starved of folate even if blood levels are normal. Now, this deficiency can disrupt brain function and contribute to developmental delays and features associated with autism. So this is the connection. So what is the right type of folate to use in these types of cases? Well, it's very important. The type of B vitamin, the type of folate used is very important. You see, not all forms of folate are created equal, and using the wrong one can be ineffective. Let's talk about folic acid. This is the synthetic form found in most fortified foods and basic supplements. Again, a synthetic form. And the body must convert folic acid through many metabolic steps to convert it into its usable form. So for people with common genetic variants like MTHFR, this conversion process is slow and can be inefficient. Then we have methylfolate, 5-MTHF, and this is the final most active form of folate. It requires no conversion at all. While highly effective for many body processes, its ability to bypass the specific antibody blockade in CFD is still being studied and being compared to folinic acid. Now, folinic acid, which has been in the news, also known as leucovorin, is a more biologically active form of folate, and it's the form that can get the folate into the brain even when primary gates are blocked by the antibodies I just told you about. So for individuals with folate receptor antibodies, folic acid, or again the prescription form is leucovorin, is the form recommended by the FDA based on research. In fact, the FDA recently approved a prescription drug called leucovorin, which I mentioned, for the treatment of CFD. Because CFD is an underlying issue in many with autism, not all, but many, this therapy is now being used to address their symptoms. So let's talk about what does the research show with folinic acid. And this is an active area of scientific investigation. Now, in a fairly recent 2024 randomized controlled trial published in the European Journal of Pediatrics, this study demonstrated that oral or supplemental folinic acid, and remember, leucovorin folinic acid is available in injection form too, supplementation of folinic acid provided significant benefits for children with autism spectrum disorder. So this is exciting news. And the study showed it improved communication and social interaction skills compared to those kids given a placebo. So let's look at the big picture of all this. While folinic acid therapy is a groundbreaking medical treatment for those with CFD, it's not a one-shot cure for autism. You see, autism is a complex condition with many contributing factors. However, folinic acid therapy, or even methylfolate, is a powerful example where an integrative approach using a specific biological treatment being identified and used can be very effective. But the best outcomes for autism are achieved through a comprehensive plan that addresses multiple factors. You have to consider things like a child's overall nutrition and their diet. Gut health is very important for absorption and inflammation in the body and the brain. The effect of chronic infections, genetic variations, genetic issues, as well as environmental factors. So if you suspect this issue may be relevant to someone in your care or someone close to you, it's essential that they work with a knowledgeable doctor. Neurologists, developmental pediatricians, and especially integrative doctors specializing in autism can perform the necessary tests to check for folate receptor antibodies and determine if this therapy is appropriate. As well, integrative doctors will look at all those other factors which could be contributing to problems. Now remember, Leucovorin is a prescription medication and dosing must be carefully managed by a qualified medical professional. Folinic acid is also available as a nutritional supplement, and methylfolate, which is really a form I use the most with patients, is readily available as too. So using targeted nutritional therapy can make a difference for these kids with autism because you're addressing the underlying biological issues. Well, I hope you found this information helpful. If you did, please hit the like button and subscribe for more. Share this video with someone who might need it. Thanks for watching.